I guess it's our team has achieved it, and that's the Arabic Healthy Weight team. This has been a really large project, a community-based intervention to promote a decrease in overweight and obesity. So far we've gathered 600 surveys, which has been a lot of work. It's involved going to shopping centres, to community organisations, to Arabic organisations, to schools.
In terms of the environmental health team, we were involved in a national surveillance of a national event called the Scout Jamboree, which was held at Cataract Dam Scout Park. Our involvement was related to environmental health surveillance, but the unit also developed a thing called a syndromic surveillance tool, looking at potential for gastro outbreaks or respiratory outbreaks from this type of event.
Myself and two other colleagues have been working in GP clinics with asylum seekers without Medicare access, so they're quite, very vulnerable people and very destitute. And we provide really important medical or clinical services for that group, and that's been a real achievement.
Throughout 2016, I've been working in the Healthy Populations team of health promotion, and we've been working really closely with the Office of Preventative Health on implementing statewide programs at a local facility level. So working on programs like the Get Healthy service and the Get Healthy at Work initiative. And we've also been working quite closely on getting some health professional referrals into the Get Healthy service. So looking forward to expanding that further next year and hopefully seeing some of those clinical pathways come into place and trying to get prevention on the agenda.
One thing we're really proud of in the public health unit, in the environmental health section, was a swimming pool seminar we held. So we put it on for council pool operators and managers. We thought there was a demand for people to find out more about the requirements. So we covered things such as swimming pool chemistry, the legislation, disease related to swimming pools and spa pools, and smoking requirements within pool areas. So we got a good response. There were about 30 people attended.
With BreastScreen 2016, our achievements were to screen as many women as we could. We've opened up more sites, so that's given us more appointments so women are able to book, and having the mobile van going around to different areas, women feel more comfortable to go to an area that's closer to their where they're living.
My involvement in the Vietnamese tobacco project, which is a multi-strategic intervention to increase quit smoking and also to reduce smoking harm-related amongst the Vietnamese-speaking community residing in Fairfield local government area. We will be working with GPs, with pharmacies, with the media. We will be delivering education program, healthy lifestyle program. So it's really exciting and interesting.
So our teams worked really hard in 2016, especially in terms of immunisation catch-ups. We've actually done over 3,000 immunisation catch-ups for GPs this year, which has been huge due to the introduction of the No Jab, No Pay policy. And part of that, in order to sort of cope with that workload, we've developed these immunisation catch-up templates, which has been developed by our team to actually help GPs and immunisation nurses to actually work out their own catch-ups, and with the support of public health being able to check them and then fax them back to providers. So that's working really well.
Well, I've been working at Chetra for many, many years and always thoroughly enjoyed it, but this 2016 I actually changed areas, and I was asked to head up the research arm of the locationally disadvantaged stream, and I've been developing a program logic for that, which looks at the type of work we're going to do in the future. So it's been really challenging and really exciting, and I'm really, really proud of that.
It would be the production of the Menopause DVD. We started with interviewing some women refugees from Iraq and Afghanistan, and also some of the women's health nurses about how they view menopause. DVDs can be very powerful tools to educate certain populations, especially when the community members have low literacy or moderate level literacy. So I would say that particular project is a big achievement for the Refugee Women's Health Project.
I have community forums at the Miller Community Centre where I do outreach for community staff, Service for Training and Research. Our recent one was a forum on climate change called Climate Change, What Will It Mean for Us? It was a collaboration of organisations, the Climate Council, the Climate and Health Alliance and 350.org. The speakers all spoke about different aspects of climate change and how it will affect us, inevitably will affect us.
In 2016 we have managed to close the gap for Aboriginal immunisation in the 4-year-old age cohort and achieve 100%. For our 1-year-olds we've achieved 94% and our 2-year-olds we've achieved 91%, which is a great achievement.
So our unit has a big grant from our Heart Foundation looking at the association between built environment and health outcome. Another large project that we are involved as well is looking at refugees after the first visit of the health clinic, and we try to improve their access to health services.
One of the greatest achievements at BreastScreen has been going through accreditation as a new service. Due to that, we needed to fill some positions, so we had a lot of staffing requirements. Since we've had new staff appointed, we found that we've reached our screening target set by the Cancer Institute.
I'm very proud of the work done at the food pantries. We have about 6 of them in the different communities in Southwest Sydney area local district. They open opportunities for volunteers to come and develop their skills, giving them access to healthy food and learn more skills and develop their skills in small businesses, and also look at establishing social enterprises and employability for themselves.
So I can tell you I achieved HPRM. This is electronically record management here. They save your actually office space. For the hard copy you don't need to keep it.
Well, 2016 has been a great experience so far. Really enjoyed building on the work that's been developed within my team. We've got quite a engaged and dynamic team that I work with, so it's really been, one of the great parts of this year is seeing that team grow and build, and with the increased output that's come from that as well.
I came into the public health unit as a new registered nurse, and part of that it's been working with the communicable diseases team. I've come to appreciate the collaborative approach which occurs within the team because, as an example, they've needed to look at pertussis, and there's been a huge increase in pertussis throughout the year. What they do is they contact GPs, they follow up with clients and the children that have been affected mainly, and work with the childcare centres that they may be attending.
So in 2016 our Healthy Children Initiative team has really galvanised itself, and throughout the year we've been offering a lot of support to services and schools, which has resulted in us meeting the targets that we needed to, and also building that stronger relationship with the services and schools as well.
Well, I'm part of the Refugee Health Nurse program, and we see families within the first week or 2 weeks of arrival into Sydney, and our job is to support them in their access to healthcare and stop them falling through the gaps basically. So make sure that they have a GP, that they are referred to appropriate services for their needs.
So a highlight of 2016 would be my involvement in the HA of the Western Sydney Airport. So we did a health impact assessment on the community engagement around the proposed airport, and it was really important to get community's opinions about it because they're the ones that it's going to impact, so it's good to get the community perspective and get them involved in the process.